Hi, I'm Scott Leadingham. Thanks for joining us here in the unique Northwest. Today we are joined by Austin Jenkins, Olympia correspondent. Thanks for joining us today, Austin.
Thanks for having me.
Austin has been doing a series of reports of late on the issue of developmental disabilities and the service delivery that those individuals receive in the state of Washington. So, Austin, we're going to dive right into that topic today. What would you say about the delivery of developmental disability services in this state? Let's broadly sum it up.
Well, generally and broadly, there's about 35,000 people who are being served by the state's Developmental Disabilities Administration. And then there are another 13,000 people who are DDA eligible, but they're not being served. And so we took a look at that unmet need and highlighted it, something that hasn't been done by a reporter in this state in about 6 years. But since then, what's happened is that the state legislature put some money towards buying down that unmet need, if you will, and actually eliminated the wait list for at least one of what are called the Medicaid waiver programs that individuals would be eligible for. What's happened since then, though, is there are now people once again waiting because there's a cap or a limit on these waivers and these baskets of services. At the same time, what we're finding out is not much is known about these 13,000 people. There are no case managers tracking them. There used to be, but those positions were cut during the Great Recession. So we don't know how many of them want services but haven't formally asked for them, how many would actually qualify. The other thing that we've learned is that the DD services in this state, developmental disability services, they don't grow with the population. They're not part of what they call the caseload forecast. So the budget is the budget, and the people who run that administration are saying that the growth is like 10% a year in people who are eligible, but the budget's not growing 10%.
Developmental Disabilities Administration, or DDA, as you've said, probably a state agency I'm willing to guess that a lot of people have never heard of or aren't really very familiar with. Can you just tell us a little bit about what exactly they are charged with doing, and in your reporting, if you found out if there are some holes in the supposed delivery of those services?
Sure. So DDA is a part of the Department of Social and Health Services, and it does a bunch of things. It's running the state's residential habilitation centers, the RHCs. And, over the decades, the state of Washington, like most states, has really moved away from institutionalizing people. We've downsized those RHCs, although unlike other states, we have not closed all of our RHCs. There are still about 600 people who are institutionalized in this state. So where do these people go if they're not in an institution? They go into the community. And so what the effort has been is to try to build some capacity in the community, and a person might be cared for by their own family members and be getting some services in the home. They might be in what's called a supported living environment where they have their own apartment or house, maybe with a couple of roommates who also are on the DDA caseload, and they have providers coming in, state paid providers through a contractor coming in to give them care, oftentimes 24/7. Some of the problems that have been identified, though, are, first off, these services in the community are not an entitlement. There are caps and limits, and as we've identified, the budget's not growing to keep up with the pace of growth in this community. But also there are tremendous workforce issues, which we're seeing across the healthcare industry, but real problems recruiting and retaining people to care for these individuals in the community. And with turnover come problems, there come violations, issues with the quality of care, and it makes it all the harder to place people when you've got high turnover. And then the really big issue, and what takes up a lot of DDA's time, is trying to manage the cases of those most complex patients. And that's really where we were focused in a lot of this reporting, is the individual who has co-occurring behavioral health needs, behaviors that can be violent at times. And those folks can be really, really difficult to place in the community. Oftentimes what happens is their caregivers, whether it's a family member or a paid agency, literally just drop them off at the ER and say, we can't handle this individual anymore. We're dropping them off at the hospital. It's somebody else's problem. And that can begin a real cascading series of events that can end up very badly for the person.
You recently posed this question in a headline and in a story that you wrote about whether disability support services for this population and these people is a constitutional right in the state of Washington. So I'll just throw it out there. Is it a constitutional right?
It's an interesting question because usually when there are lawsuits over access to services for people with developmental disabilities, or really people who are disabled generally, those lawsuits have to do with federal law. So an advocacy group will sue, for instance, under the Americans with Disabilities Act, federal law. However, the Washington state constitution, first off, we know that the state constitution is very clear, very explicit, that the paramount duty of the state is to amply fund public schools. And there was a lawsuit, the McCleary lawsuit, that went on for a decade or more over that issue. There are lesser known articles in the Constitution that have to do with other provisioning other services. And Article 13 of the state constitution talks about the state providing institutions for children who are deaf and blind, for the mentally ill, and for people with developmental disabilities. And some constitutional law experts and appellate level lawyers have looked at this and said, you know, institutions could be defined broadly. It doesn't have to mean a state psychiatric hospital or a residential rehabilitation center. And furthermore, this seems to impose an entitlement, if not a right, bestow an entitlement, if not a right, upon individuals with mental health needs, with developmental disabilities. And then the question becomes, is the state living up to Article 13? It really hasn't been tested in modern times, and it's not quite as ironclad in the wording as Article 9, which is the paramount duty education clause. Nonetheless, these appellate level lawyers are intrigued, and they think there might be an avenue for litigation to test that question. Are these services a constitutional right in the state?
Your reporting of late has highlighted an issue that I think people might be sort of tangentially aware of, but not really aware fully of how prominent it could be and is in the state of Washington and elsewhere. And that is the idea of people who are essentially stuck in hospitals because of their a mental illness or developmental disability, but they don't actually have any medical need to be in those medical hospitals. It's not a psychiatric hospital. And your reporting highlighted the family and the plight of Christopher Davis in Spokane and Sacred Heart Hospital. Tell us a little bit more about what they've gone through.
So we first met Christopher Davis and his family when he was in a supported living environment, living in an apartment, and that provider was shut down by the state, and he needed to find a new provider. I checked back in with the family a couple of months ago, and they told me that Christopher was in the hospital at Sacred Heart in Spokane and had been since December. So this had been going on for 8 months. He'd been brought to the hospital because of some behavior issues. He'd been cleared for discharge, but then there was nowhere in the community to place him. And his mother, who is his guardian and a fierce advocate for him, was not comfortable with him being sent to another community. So he remained in the hospital, but it really highlighted a recurring issue, which is that for these more complex clients, finding an appropriate placement in their home community can be a real challenge, and the result can be that somebody remains stuck in the hospital for months and months and months.
You also highlighted the issue of court fines and contempt orders racking up against the state of Washington as a result of all of these things you've been reporting on, and you talked about that by way of a man named Fred Ackerman and his family and his sister Dawn. Tell us a little bit more about what's happened with them and why the state is racking up fines and contempt orders.
Yeah, this is where these systems start to really kind of complicated and overlay each other. Big picture step back, there are people who are stuck in the hospital who don't have developmental disabilities. In fact, from what we've been able to discern talking to the Hospital Association, most of the people stuck in a community hospital with nowhere to go are people with dementia, so probably older and need dementia care, and that's very hard to find, especially if you're on Medicaid. When you start looking at subsets of those people, there are people with developmental disabilities. There's another subset of people who are stuck in community hospitals, sometimes in a regular hospital bed and sometimes in a psychiatric ward. And they have been found to be so debilitated that they meet the criteria for involuntary treatment. And then they are needing a bed in a state hospital. That would either be Western State Hospital or Eastern State Hospital. And that's the case you're talking about, where this individual was here at a hospital in Olympia, where I am. He was very difficult to manage, and the hospital finally went to court to say to the state, you have to take him off of our hands. You need to get him a bed at Western State Hospital. And when that didn't immediately happen, the community hospital went back to court and asked the judge to find the state in contempt. And then, when contempt was found and a bed was still not made available, the hospital went back and asked for sanctions to be imposed. So that is definitely a trend to watch. It all goes back to this issue of people being stuck in the hospital and the lack of available state psychiatric beds.
It's been an incredible amount of reporting. I hope you get some sleep after all this or take a little bit of a vacation. And we thank you for sharing it with us today, Austin. Thank you for joining us.
Thanks for having me. You're welcome.
You can see all of Austin's reporting on these and other topics at our website, nwpb.org. Thank you for joining us here in the unique Northwest.